Misread CPT 99484 Behavioral Health Integration as a per-session code, and you bill once for a whole month of care management work. The 20-minute minimum is cumulative across the calendar month, not per visit. Treat it as per session, and you leave a billable service unclaimed. CPT 99484 Care Management for Behavioral Health Conditions. At least 20 minutes of clinical staff time per calendar month. Here's the guide for billers and administrators. We cover the CMS definition, the required components, reimbursement, and the most common billing mistakes. CMS defines 99484 as care management for behavioral health conditions, at least 20 minutes of clinical staff time, directed by a qualified professional per calendar month. Introduced in 2018, it is billed once per calendar month for each eligible patient and pays for managing behavioral health even outside face-to-face visits. Unlike some other behavioral health integration codes, 99484 does not require a psychiatric consultant. It covers general integration that incorporates some, but not all, elements of the psychiatric collaborative care model. Because 99484 pays for time you cannot see in a face-to-face visit, the documentation is the claim. Miss an element, and it is exposed. Failing to obtain and document patient consent before starting behavioral health integration services means the service is not billable. Under-documenting the services and the time spent leaves you exposed if a payer audits the claim. There is a reason payers built this code. A 2021 study found patients receiving behavioral health integration services had 23% lower total healthcare costs than those receiving usual care. That 23% figure comes from a published study cited in the Post, comparing BHI services against usual care, and a 2022 report found 67% of primary care physicians saw rising behavioral health needs among patients since the pandemic began. A compliant 99484 claim has 6 required components. Miss any one before you bill, and the claim is incomplete. Let us walk through all 6. Component 1, the initial assessment. Assess the patient's behavioral health needs using validated rating scales. Component 2, care planning. Develop a care plan related to the patient's behavioral and psychiatric health problems. Revise the plan for patients who are not progressing or whose status changes. Component 3, facilitating and coordinating treatment. This may include psychotherapy, pharmacotherapy, counseling, or psychiatric consultation. Component 4, continuity of care. Maintain ongoing communication with the designated member of the care team. Component 5, the time requirement. At least 20 minutes of clinical staff time, directed by a physician or other qualified professional, per calendar month. Remember, it is cumulative over the month, not per session. This is the most misunderstood part of the code. Component 6, documentation and consent. Document all services provided and the time spent on each, thoroughly. Obtain and record patient consent for behavioral health integration services before you begin. Rates vary by payer and contract. Verify current rates before relying on them. As of 2023, the national average Medicare payment for 99484 is approximately $48.45. Medicaid rates vary by state, but are often similar to Medicare rates. Private insurer rates can vary widely and are typically higher than Medicare. The most common 99484 billing mistakes are all preventable, and most are documentation and process gaps, not coding errors. Under-documenting the services delivered and the time spent on them. Overbilling for time that is separately billable under another code. Neglecting to obtain and document patient consent. Misunderstanding the 20-minute minimum as per session rather than cumulative over the month. A behavioral health EHR with built-in time tracking makes it easier to meet the 20-minute cumulative threshold each month. That is what Behave Health is designed to support. Built-in time tracking is designed to total clinical staff time across the month, so the cumulative threshold is visible before you bill. Consent, the care plan, and the assessment are designed to live on the patient record, the elements 99484 requires. By connecting documentation to billing, the platform is designed to help your team submit complete defensible 9484 claims. Stop leaving 99484 revenue unclaimed because the time rule was misread. Book a 20-minute demo at behavehealth.com. See time tracking, consent, and care plans built for behavioral health integration billing at behavehealth.com.